you may have had cancer in the past, but I think we all want to prevent cancer. And much of what we'll talk about today will apply, to not only people that are in cancer survivorship, but also for those of us who want to prevent cancer, extend our health span, and just live long, flourishing lives. Hi there. Welcome back to the Rethink Aging podcast, where we explore how to protect your brain health, build resilience, and flourish through midlife and beyond using a whole person evidence-based approach. And today's conversation is very, very special to me personally. I'm joined by my dear friend and trusted colleague, Dr. Liz Hart. Welcome, Dr. Liz.
Thank you, Cindy. Thank you so much for having me. It's just an absolute privilege and pleasure.
Yeah, it's delightful to be here with you. Dr. Liz and I have known each other for several years now. She's a medical doctor and a certified functional health coach, which is not your typical combination. She's also a board certified health and wellness coach, and she lives and works in South Africa. And despite being, a half a world away, we really share a lot. I feel a strong connection across the ocean to you, Liz.
Thank you, Cindy. Yes, likewise. It was lovely to actually meet in person a couple of years ago, and then the rest has
Yeah.
kind of been online, hasn't it? But we share a lot of things in common in the way we see medicine and health and longevity and so on. So yeah,
Mhm.
uh,
Yeah,
I really do
we
feel that
share our faith. We bonded initially
we
over our
do.
shared faith and
Yes.
just this, perspective that we're whole human beings and we need to tend to our not only the bodies, but also mind, emotions, soul, spirit, all of that. So
Absolutely.
today,
Yeah.
we're going to talk about resilience after cancer, not just surviving cancer, but actually flourishing and coming out the other side with renewed vitality and maybe even a renewed sense of purpose in life. And so welcome. I'm grateful you're here. Liz, I love learning about people's journeys and especially other doctors who've taken the path least traveled. So if you could just share your background and how you came to be who you are today, what your path has been like through medicine and now into cancer survivorship coaching, and what drew you to that, what made you who you are.
Yes. Well, I studied medicine here in South Africa, and then I worked overseas for about 3 years in different places: Canada, the UK, New Zealand. And I did different aspects of medicine, and basically ended up qualifying myself as more of a family medicine practitioner. I didn't do a formal qualification; it wasn't available when I qualified, but yes, and then when I came back to South Africa, I did emergency medicine for a while, and then I ended up, when I got married, I actually started as a family medicine practitioner, and that was an interesting period of my life. It was about 7 years. I just did that, and it was interesting because I realized that we were so well trained at medical school to deal with the big issues with very sick people, with people that end up in hospital, which is essentially very sick people. But then as a family medicine doctor, I was now seeing things that I really wasn't prepared for. I didn't have any training in really, and I got a bit frustrated because I felt like I was just, seeing a patient for 10 minutes, writing a script and sending them out there. And that was the end of that. And then I started also seeing a lot of things that I couldn't help, them people with, a lot of lifestyle diseases, which you feel like you send them with a script, and surely there's more to it than that. And then at the same time, the timing is God's timing often, isn't it? I developed chronic fatigue myself. So I got really sick, really bedridden. I couldn't work for weeks on end sometimes. And that sort of thing. And then I started to look at alternatives because I went to the medical library. I looked up chronic fatigue. I got absolutely zero guidance as far as, conventional medical wisdom was concerned. And so I had to look further afield. And so I was lucky I came across a doctor who was probably one of the first functional medicine practitioners, certainly in South Africa. And she started me on the path of looking at lifestyle things, looking at what I was eating, what I was supplementing, all these different aspects of health that started to make a difference to me. And so then I could start using them with my patients as well. And yeah, so that's kind of the beginning of what happened. So I then after 7 years, I was asked to work in a breast cancer setting, really more in assisting in theatre and operating and all of that. And so I've done that for many years now. But then I just thought to myself after quite a few years of that, I needed something a little more. And so I did the functional medicine health coaching course. And that was a year-long, really intensive, really good course, I thought. And I learned a lot. I learned it's very different being a coach to being a clinician, very different
Mhm.
approach. Yes, and then Professor Ben asked me to start the survivorship program at the Mill Park Breast Care Center of Excellence, which treats breast cancer essentially. So I've been involved in the survivorship role now for about 2.5 years. So that's my
Amazing.
story.
Well, I love it's such a common theme that God uses our challenges, our often our deepest pain and struggles in life, to make us who we are and to evolve us in a way that up levels our well-being and helps equip us to help other people. So that's so evident in your
Definitely.
story. Mhm.
Yes. No, I would definitely not be where I am without my own experience, because you just got more credibility, don't you? And well, it's more
Mhm.
interest and research and whatever, so you bring more to the table. Yeah,
Yeah, and I can definitely identify with that disillusionment in the family medicine training. I mean, it's a beautiful field. It's a wonderful, noble, very necessary field, and training in hospital care and that, life-saving medicine is critical. But you're right, when you get out into private practice or, beyond the hospital walls, we're often ill-equipped to deal with the complex chronic illness with just pharmaceuticals in those brief visits. I think, the coaching training you mentioned with the functional medicine coaching, that to me should be foundational for any medical training where we actually learn how to talk to people about their health, understand what motivates them, help them, walk them through a process of behavior change and lifestyle, upgrading because that's the true medicine, the foundational medicine, and
it is.
sadly in our conventional world that's not valued or, often we don't get training in that. So kudos to you for going beyond your additional training and doing that. I know it's not necessarily a path that the world rewards in terms of financial rewards, but it is great in terms of patient care and actually helping people. So
Yes, I think so. I have to, it's difficult switching, because our approach is different, because as clinicians, we taught to, okay, get to the bottom of what's wrong, make a diagnosis, write a script, or, find a solution, and that's it, fix it. Yes, fix it. And you're under huge pressure, actually. We are as clinicians to, to find the cause and fix it and whatever. Coaching is a very different process because it's very collaborative. It's all about us and the client or the patient as in collaboration, working out what works for them. Long term.
yeah, I love the coaching model where you're asking those deep, evocative questions to help draw out what's inside the person because, each person, they have the wisdom inside and they know, what they're living for, what their meaning and purpose is, what drives them. And, it takes some skill and some time to ask those important questions and to sort of guide people through a self-exploration process.
You're right. It does take a lot of listening, and asking the right questions and so on. But it is time. You need time for it, and uh, that's what doctors often don't have, and that's the problem.
Yeah, yes, it's unfortunate that third-party payer system, whatever that is, with insurance companies kind of dictating how much doctors get reimbursed for periods of time they spend with patients, then it kind of takes everything down to the lowest common denominator, and those doctors who are wanting and willing to spend the time with patients, that is not rewarded. It is definitely
No,
penalized in our
it's not.
system.
That's right.
Mhm.
And it
Yeah.
ends up being the patient that has to pay the extra. So,
Uh-huh.
yeah, even in cancer, you know.
So, as you know, many cancer survivors, and just a little personal aside, um, for the listeners, this topic of breast cancer is very near and dear to me. My dear beloved mom, we lost her about a decade ago now in her mid 60s to breast cancer, and we also have some other family history of breast cancer. I have 3 daughters myself, and, it is of keen interest to me to prevent breast cancer, and I think a lot of people, whether you're listening, you may have had cancer in the past, but I think we all want to prevent cancer, and much of what we'll talk about today is will apply, to not only people that are in cancer survivorship, but also for those of us who want to prevent cancer, extend our health span, and just live long, flourishing lives. So, but specifically for women that have gone through breast cancer treatment, they're often told, at the end, your scans are clear, you're cancer free, yet they don't feel like themselves. How do you walk people through this journey of closing that gap between, being cancer free and trying to grapple with all the changes that they've been through and just the fallout emotionally, spiritually, physically? How do you walk people through that?
Well, I think, it's such I just saw a client this morning, the same story, she just said, I'm just not the same person I was, how do I get back to, you know and the truth, what I try and normalize is that this is normal. That actually you are not the same after a cancer journey. You are just not the same person. You're not the same physically, mentally, emotionally. You just aren't the same because you faced a life-threatening disease, which has got huge emotional and mental kind of effects. Just that. And then you've had to go through a lot of physical, whether it be surgery, radiation, chemotherapy, whatever it is you've had to have, which has often changed your body. In fact, I thought about you this morning because, the client I had has got brain fog, really badly from immunotherapy, actually. So, her brain has been affected by her treatment. And so, how do you need to get that back. So yes, firstly, I just try and normalize it that this is normal, the normal to feel this way. A lot of people feel after the journey that they get abandoned because a lot of them are fine while they're going through the treatment because you've got this whole team and you know that you've actually a lot of you've got good surgeons, good chemo, oncologists, etc., that are helping you, and you feel very held in that space. And then you get to the end and they say, oh well, okay, I've treated you, now off you go, and you might see them every 6 months or something for a checkup, but that's it. So people feel abandoned. So that's kind of where I come in. So yeah, firstly, it's normalizing it, and then it's trying to help people just process as part of it, what's happened to them, come to terms with what's happened to them, and then think about, okay, well, this is a new me. This is a new normal. How do I then navigate this, and find out what I want to do with the rest of my life, which may change because of the experience you've been through, you know.
Absolutely, and I love that you, focus on that aspect of it because there's always opportunity in our illnesses, even if they're catastrophic or maybe especially if they are catastrophic, it's an invitation into why am I here? What's my meaning? What's my purpose in life? And so that is a very, tender, holy ground that you walk people through,
Well, it
grappling with
is.
the Mhm.
It really is, and the only gift in this kind of thing is that you come to these realizations of how precious, your life is, and how how much you are held by God, and how much you still have to do, because there's a lot of gratitude often, with people getting to the end of this journey. Wow, I'm here, now what? Now what? What do I do with what I've been given? And suddenly, suddenly what we have is so valuable, because it's been all at risk for a while, so yes, that is a privilege, and I tell you, these survivors are so inspiring to me. I am so inspired by them, their courage, and these realizations, and this kind of, okay, I want to live my life properly. I want my life to have some value. I want to give back, or whatever. They're very inspiring, really.
Beautiful. And Liz, I know you take a very holistic, whole person approach, especially with maybe the trauma piece, the emotional piece that people are grappling with after cancer therapy. Tell us about some of the collaborations that you work with in terms of helping people connect to the breath work or therapist, that sort of thing. What complementary and collaborative pieces are there to your work?
Yes, well, I'm not the expert on all these things, and there are people out there that are experts at so many wonderful things, and I'm discovering more and more. Every week there's something else I'm discovering, that can help people. So I just see myself also a little bit like an umbrella kind of, person. If I can pull people together and to provide a more holistic experience for people, and different answers to things, so, we've done, I've got maybe I should just lay it out in a way now. I've got a kind of a six pillars that I deal with people. And those are the classic five functional medicine pillars, which is nutrition, exercise, stress management, sleep, and relationships and community. And then the sixth one is dealing with past trauma. And that I only get to, once you've passed your treatment stage, not with a new patient. So I deal with those, and what we've been doing is doing webinars on each of the six pillars, and we've been lucky enough, and there God is good again, because I just, these people fall into my lap at the right time. It's amazing to me. So for example, I've got a dietitian nutritionist that is specifically got a master's in oncology nutrition, that I work with, for example. And then
Nice.
I've got a biokineticist who's done a whole specialized, and a physiotherapist who's specialized in oncology, physiotherapy and biokinetics. And I've got a couple of doctors, a neurologist, for example, who looks at things like brain fog and all the side effects of cancer treatment, and how you can train your brain again. And she did a whole lot of exercises with us. She used music as well, which was an interesting one. Um, Another colleague of mine also, she just has got a specialist on breathwork. She's written 2 books on the subject. She's come on and taught people And on my website, she's given us breathing exercises we can use for stress management and so on. Yeah, and I just had a psychologist on last week talking about dealing with trauma and how trauma sits in the body, and that was my own experience. Um, Interestingly enough, I didn't say that initially, but with my chronic fatigue, I had to deal with my past trauma to get rid
Uh-huh.
of the fatigue in the end. I mean, I did a lot with nutrition and the other things, but it was actually dealing with, the trauma that you hold in your body that ultimately led to me getting rid of the fatigue. Took years, but actually the final thing that I needed. So yeah, she talked us through that. So you know and next month we actually have a survivor who's going to be talking about her own breast cancer journey, and then how she started a whole organization that actually helps people create the relationships and community and people that you need around you, a team around you, to actually optimize this journey and how you create that team. So yeah, and then I mean I've had a discussion with a music therapist. She's using music therapy in theater. She's literally putting
In the
earphones on
operating room.
in the
Amazing.
operating room. And as the patient is going to sleep, she's getting her favorite music played to her and calming her
Ah,
down. And they've actually done studies to show that people then need less medication during
amazing.
their anesthetic. They need less
Mm,
anesthetic drugs, which is fantastic.
I love
So yes,
that.
there's
Yeah.
so many things we can use.
Well, beautiful. I love your holistic collaborative approach. Want to shift gears now and talk about, this connection. It might not be immediately obvious, the connection between cancer recovery and aging well. But I think what a lot of people don't realize is that, the treatment for cancer, we know it takes a huge toll on the body, physiologically, places a lot of stress, that actually sets the body into an accelerated aging or premature aging path. And so I wanted to talk a little bit about each aspect of that and why that happens, and just give our listeners maybe some practical tips with each of these, and we can just have a conversation about it. One thing that I see with cancer treatment is mitochondrial injury, the little energy factories in all of our cells. Many cancer treatments are just, directly toxic or impair mitochondrial function, and that can result in the profound fatigue that we see, the brain fog, exercise intolerance, slower recovery, and it's often a big part of why people just don't feel like themselves after cancer therapy. So, how do you help people with their energy level and mitochondrial health following cancer therapy?
Well, as a coach, as a functional medicine coach, I take them through, the lifestyle modification factors that help. I'm not functionally medicine trained as you are, so
Mhm.
I don't see myself as an expert as you are in that. In actually treating that dysfunction. What I can do is I can definitely help them with all the lifestyle factors. And we know, for example, that exercise increases your mitochondria. We know that there's certain supplements that do, etc. And I give some people advice on those kind of things. So I do try and approach it quite holistically like that. Um, but I must say that if I really find somebody is very fatigued, and my interventions just from a coaching point of view, from a functional medicine coaching point of view, are not enough, then I would refer them. I would refer them to a functional medicine practitioner, for apps for testing and for more proactive interventions. Um, I definitely would do that.
Yeah, well, I would not underestimate the impact that you have with the lifestyle medicine coaching aspect. That's one thing I love about functional medicine and lifestyle medicine is that the interventions we do, at the foundation, as you said, the sleep and the stress management, nutrition, community, relationships, all of that has an impact on the entire matrix of our systems of biology. And so, optimizing sleep and getting gentle exercise and working on mindset, all of those things have a cascade effect for our mitochondrial function and our energy levels.
They
So
do. It's so remarkable actually to see it. Yes, for sure.
it's one of the beautiful things about, prescribing lifestyle as treatment because you get positive side benefits instead of
Yes.
the long list of side effects with a pharmaceutical dominant approach. Again, there's nothing wrong with we're blessed to have pharmaceutical interventions when they're needed, but, they do come with side effects, and
They
it's
do. Yes.
wonderful to have a holistic model for helping people. And so in addition to the mitochondrial dysfunction we can see after cancer treatment, there's often chronic smoldering inflammation that happens even years after treatment. I know, I monitor inflammatory markers in my patients that have had cancer, and that's something we really aim to address to try to lower inflammation in the body, get the CRP, the C-reactive protein optimized. So we know that inflammation just accelerates aging, the vascular system. It contributes to pain and stiffness and just our long-term disease risk. And so again, the holistic model that you help walk people through will address inflammation on a whole person level. Are there, specifics with nutrition, or tell us how you address inflammation from a functional medicine coaching standpoint?
Yes, just to say, I mean, inflammation is a risk for cancer. So, there was probably a lot of inflammation going on before the cancer happened. It was one of the contributing factors potentially as well. So it's certainly a risk. And, if you're wanting, to prevent cancer, as you know, we need to minimize inflammation generally. So, I think, I do a lot then with what people are eating. I mean, your nutrition is super important with inflammation. You can eat inflammatory foods and you can eat anti-inflammatory foods. You can take supplements that are anti-inflammatory. There's a whole lot of guidelines I give people on those kind of things, and it's quite general. We use the Mediterranean diet mostly. It seems to be the one that's the most proven, which is a very anti-inflammatory type of diet with lots of good oils in it and decent protein and whole grains and lots of veggies and fruit and lots of fish and so on. So it's a very anti-inflammatory type of diet. So that's kind of the one I would advise people to use, and then maybe supplement as well with things like omega-3 and curcumin even, or some more the more anti-inflammatory supplements. So diet is very important. Their stress levels are this is often, it's been such a stressful time. So you could imagine what their cortisol levels are like and their hormone levels are just all over the place. Insulin resistance, all the stuff that comes with really intensive treatment that's so hard on the body. Um, so I look a lot at managing stress, because if you lower stress, you lower inflammation. I mean, cortisol and inflammation just go together. So you have to lower that. So we do a lot breathing exercises, meditation, prayer, whatever it is. I've got a program I suggest people do. And as I say, I've got breathing exercises on the website. Exercise, once again, it should be a prescription. It's so important. It makes such a difference to your stress levels and also to your inflammation. So yes, I mean, I really just take them through each pillar and we try and optimize them. Um, and the sleep, of course. You can't actually, they all go together. So I try and address each one. And usually, you talk to people, and I'm sure the people listening now will be the same. Now I sort of start saying nutrition, exercise, and there's always one that leaps out at people. Oh, that one I'm not doing, that one I have to fix. And that's usually then, we focus specifically then on that one first, and then but I give them optimum, of what we'd like it to be. So, but it's, as you said, it's amazing just fixing those things, what it does, and how it helps people.
Yeah. Yes. I stress and then the fitness piece are so huge with warding off that chronic inflammation. Within our Rethink Aging community, we have February is our month to focus, really dial in on fitness. And so I just had a master class on that and talking about, you said exercise should be a prescription. And that's, that was my message as well. We need to start thinking about movement as medicine and how can we make it fun? Because, and I think that's probably a very important part of your work as well, is like bringing joy back into the process and into life because a cancer treatment or really any chronic disease when you're interfacing with the conventional medical system, there's often a lot of fear and, rightly so. There's, real risks and challenges with the interventions, surgery and radiation therapy and chemo. How do you encourage people around that, layering in joy and with all of your your lifestyle medicine coaching and counseling, how do you bring joy back into that process?
Yeah, that's such a good point. You see, I have to switch to being a coach and not not being a clinician and trying to diagnose and fix and I mean, I really have to consciously do that on a daily basis. But yes, I think the first thing I do with people is try and get them to take a step back and stop being so hard on themselves. That's the other
Mhm.
thing. I'm trying to help them get their lifestyles right, but I'm also saying, just let's take this one step at a time. Let's just do it. You're never going to do exercise you don't like. So let's
Right.
let's talk about that. What exercise have you done in your life that you love? Like for
Mhm.
me, I love to do. I was a dancer. So for me,
Mm.
I had to, find something that took me back to that, because I can't stand the gym. I can't, I'm never going to go for a run now. So I think we're all a bit like that. So find something that you love. And I discovered Pilates. Pilates is I love
Nice.
Pilates. It feels most like ballet to me. So I go do that every week, and I just love the feeling that it gives me of moving my body. So you need to find something like that, and so we explore that, and find something that yeah gives you joy, and then I think managing stress also has so much to do with doing things that do give you joy and that renew you, being outside, forest bathing, or just sitting in your garden with your feet on the ground and listening, just listening, doing a bit of a mindfulness exercise. So I try and teach people those kind of things, and um and finding the joy. But it's interesting because the cancer journey, a lot of women that have had it, they now they don't take things for granted anymore. And that's sometimes what they found, is that the gift in this, if there is a gift in cancer, it is that they realized how precious life is, and finding joy in the little things, and they actually they see that, and they can start actually tapping into that, which if there is a gift, that's it, that they find.
Beautiful. Yes, I find myself having that that conversation a lot with my patients, that, we're in the chrysalis moment where, it's scary. It's dark and you feel like you're dissolving and there's a lot of uncertainty. But, there's an invitation there and it's a surrender process and then, a journey of unfolding to see what's next. And yeah, I'd love to hear just your perspective, your experience about walking people through that process of coming to terms with like the deeper questions that emerge out of going through a cancer journey. So we're focusing on how the physical piece, how to get the energy back, how to feel better, deal with brain fog, and we have all the tools and the functional medicine, lifestyle medicine coaching How do you walk people through that invitation of like what's next for me after this?
Yes. Oh goodness, and it's so different for it's so different for everybody. I think, you know, having a bit of life experience helps, because I've gone through stuff myself, not cancer, but yeah, you need to be sensitive to people's journey. And I think, they tell you, this is the privilege of being a coach is that I ask the questions, but they come back, and people, you said it earlier on, and I think it's an important point. People are the experts in their own health, actually.
Mhm.
That you are the expert in your own health, you're the expert in your own emotional, mental, physical well being. You have the answers inside you. So, it's my privilege, I think, to try and elicit that from them. What is it that you've learned? What is it that would make your life have meaning now? What has changed, and how can you adjust to that? But so what next?
Mhm.
And they have the answers. I don't usually, because people are different, and that's part of the joy of this for me, is actually being able to elicit that from somebody, and suddenly a light goes on, and suddenly they think, okay, this is where I can find meaning again, and that's an amazing process. That's why I love coaching. It's just that process of helping somebody find those things.
Yeah, it is. It's a beautiful journey getting to walk alongside people through, a health crisis and just watching how things unfold and how they're evolving and stepping into the new phase in their life. I'd love to talk to you all day, Liz. But let's wrap up with how does your faith, your personal faith, how does that inform your work? How does it sustain you? What kind of things do you do to keep yourself emotionally, spiritually sound? I know this work can be very draining when you're walking people through deep suffering and challenges. Tell us about your faith and any practices you do to help keep yourself grounded and healthy and well.
Yes, I think the biggest thing, for me looking back, is just that God has taken me on a journey. I felt so much like I am where I am now. I'm building up a survivorship program. I really, want to help women in this, because it's pulling all my different skills together, and all my history, that He's brought me to this place, and I'm so sure of that, and it's such a comfort to know that I'm really in the right place at the right time with the right skills to do this, because He's brought me here. And that's just, it's an amazing feeling. And actually saying it out loud now to you is really quite moving to me. Um, but I have, my faith has been very, very important for me. And this year, in fact, it's 30 years since I gave my life to the Lord, and I
Amazing.
30 years, it's a long time, and I just see how He's worked in that whole time, in times where I thought, "Oh, where am I going?" But there was a plan. And, and here I am, and I think, I'm very careful with people. Obviously, I don't, express my faith openly unless they do,
Mhm.
and but I do try and bring the spiritual aspect of you as a human being into what I do, because I don't see how you can navigate such a life-threatening diagnosis without it. I can't see that. If necessary, I would share my story, but I'm careful. But I do think that spiritually, I don't know how you do this without a spiritual backing and foundation, because and the ones that have that often come out at the end of it feeling like there was some purpose in this, that they've learned something, that they've become closer to God, that they've, and that He has a plan for them, because there's always a gratitude in the fact that they're now cancer free and, they can carry on with life. So yes, I think it's absolutely foundational. And I don't know how I would have got here without it. And I don't know how people do this journey without it, but yes.
Oh, beautiful. Thank you for sharing, Liz. I am so grateful for you and your wisdom. And it's just been a delight for me to see your journey and the unfolding of this cancer survivorship work. And it's a privilege to be able to collaborate with you and be able to refer patients to you, across continents here. And so I'd love for you to share with our listeners, people that may have be journeying through a cancer diagnosis or who are on the other side of one or who have a loved one. How can they reach out to you and learn about your work?
Yes. Thank you so much. Thanks, Cindy. I've learned so much from you too, I have to say, and it's a wonderful collaboration for me. Yes, you're welcome to go to my website. I think that's probably the simplest, heartreach.life. You can see the spelling of Heartreach down the bottom there, and .life. And there's a contact page there, and you can just contact me via email, and I will get back to you straight away, and we can set up a time. It's wonderful. We can do things, via, different platforms now. We can do it virtually, which is wonderful. So, yeah, and really, I'd love to hear from anybody who's struggling. I don't just deal with people who've already had cancer. I start at the beginning, because survivorship is actually, the definition is really, it's from the moment you're diagnosed for the rest of your
Mhm.
life.
Yeah.
So I deal with a lot of people, a lot of women who have, just been diagnosed and are going through the throes of treatment as well. So you often need support during that time. So any time during your journey, I'm here, at the other end of an email, and we can connect.
Beautiful. Well, thank you for listening. Bye for now.
Bye bye, and thank you.
Thanks for watching. If you enjoyed this episode of Rethink Aging, please like, subscribe, and share it with someone you love. For more episodes and highlights from the show, you can check out more videos right here and here. I also invite you to join the Rethink Aging community at caringforthebody.org, where you can find more resources on how to better protect your brain, strengthen your body, and live with purpose. Thanks again for tuning in, and I'll catch you in the next episode.